So I'm gonna do hand hygiene, gather all my supplies, which I have. I'm gonna identify the patient using 2 identifiers, so name and date of birth. And then I'm gonna offer pain measures. So I have 2 topicals, EMLA, which takes about an hour to work, and LMX, which takes about 30 minutes to work. And then I have lidocaine, which takes about 30 seconds, and freeze spray, which works instantly. Okay, so then I'm gonna open this. And then I'm gonna take this sticky backing off and then make sure it stays sterile, so I'm gonna put that over here. And then I'm just gonna make sure all the air's out. And then attach it. And then prime it. And then just make sure this is loose so it's able to come off easier. Okay, and then now I'm going to apply the tourniquet. Select the vein that I'm going to use. Okay. And then now I would place the towel underneath the patient's arm and then wipe off any excess topical that was used. Okay, and then I'm gonna do hand hygiene and put on gloves. And then I'm just gonna clean the site for 30 seconds, doing a good scrub up and down, back and forth. Okay, that's been 30 seconds. And then I'm gonna open this up. And then reapply the tourniquet, making sure that I don't touch where I just cleaned. And then take the cap off. And then rotate this about 360 degrees. Make sure the bevel's up. I'm gonna hold it like that. And then I'd make sure this is dry too before doing it. And then hold the skin taut. And then warn the patient of a slight poke and then go in at that 10 to 30 degree angle. And then once I see flashback, advance the catheter. And then I'm gonna release that, occlude the vein, stabilize the catheter, and then make sure my safety is activated. There we go. And then flick this part off. Careful not to touch the top of it. And then I'm also not touching the insertion site. So then I'm gonna release and then just kind of twist that on. Not touching the insertion site. Okay, and then stabilize this and then flush and check for patency and make sure there's no nothing wrong there. And then I'm still gonna hold that. And then I'm gonna put this on. And then remove the backing. And then since I already flushed, I can take this off. And then I'm just gonna put this piece over the top. That piece there. And then I would observe the IV site for any complications, and then I would dispose of all my supplies in the correct receptacle, and then I would chart the patient's response, date, time, catheter size, number of attempts, infusion site, and all that.